And startup is very unique. You are waking up in the morning and you are dealing with challenges that nobody deal with before you. And you need to make decision. You need to create process. You need to create something new. So at the beginning, nobody understands you. Everybody thinks that you are coming from the sky. Everybody thinks that it's very dangerous. It's very risky. I cannot understand that. And you need to explain it again and again and educate the people. Everything is new for you. And this is what I love in startup. Hello, 성실캠프. I am Uzi Sofer. I am the CEO and chairman of Alphatau Medical. I am also the co-founder of Alphatau Medical. Wow! So Alphatau Medical focus on development in the future commercialization of special technology called DART, diffusion alpha radiation therapy, when we can treat any solid tumor with alpha particles. So we checked our technology in different animal models, more than 20, and we didn't found any cancer that is resistant to alpha. In our last raising, when we became public, big part of that came from money from South Korea with our friend here in Yozma Group. Yozma Group introduced us to some of the hospitals in Korea, very, very high technology, very knowledgeable doctors and very high skill that we can work with. So we introduced to them and we discussed with some of the big name hospitals here in Korea about different indication that they want to start to treat patients under study. And also we want to get the Korean FDA and to come to start our activity also on the commercialization here in South Korea. It's a very important country and this is part of our strategy to come to Korea. I was the CEO, a co-founder of a company called BrainsWay. BrainsWay is a medical device company focusing on technology called Deep TMS. Deep transcranial magnetic stimulation. It is a medical device for neuropsychiatry disease like depression, OCD, addiction. Before BrainsWay, I was CEO, CFO, and chairman for different public and private companies. I started in business when I was very young. I'm very happy about that, and I have a lot of experience for many different businesses. I started BrainsWay from scratch in 2003. I took the company from this scratch all the way by building R&D, clinical trial, regulation, success, 13, 14 approval in Europe, the first approval with the FDA for depression. I did many multi-centers for the company in the US. Also, we got the Anvisa in Brazil. And after 13 years, when the company started to work and to be a big company, so I resigned from the company, not because of any reason, just before look to the next step, the next position, the next challenge. All my life I took challenges. I jumped from challenge to bring a lot of hope and happiness to the world. I finished with BrainsWay and I looked for the next challenge, and I'm very happy, thanks God, for this challenge of Alphatau, that we are doing wonderful things and saving life. Even doing clinical trial, we are saving life. Those people that we are treating have no standard of care. They have the doctor have nothing to offer them to treat them. And you treat them and they will be cancer free. You know, the feeling is the most important for me. I choose to go to Alphatau with alpha exactly because of the difference to beta and gamma. Beta and gamma is well-known. There are many external beam and different technology, brachytherapy, external beam technology. That's not a breakthrough. The breakthrough and the challenge is to bring alpha that it's more potent and conformal, and to bring that to the market, because nobody could bring alpha to the market to treat cancer, to treat solid tumor. The range of alpha is a few micron, and if you want to treat 5 centimeter lesion or 7 centimeter lesion, you cannot do it with the alpha, because you need to put tens of thousands alpha to treat those patients. So the overcome of this challenge came with the DART, the diffusion alpha radiation therapy, developed at the Tel Aviv University. And for me to take this as a challenge and to take it from technology to the market, this is what I looked for. Patient react, we have about 100% overall response rate. And in the last study, in the pilot study in the US, we had 100% complete response. So all those patients are cancer-free now, and they recommend this treatment anyone else that think that they have no standard of care for skin and head and neck, so they recommend them to use the Alpha Dart. Yes, I had a lot of difficult moments. I'm not sure that I can say one of them as one, but I can give you in a different fields, in a different aspect. For example, on clinical trial, first clinical trial, when we moved from animal to human, that was a very difficult moment to get the first in human and to treat the first patient. That was very difficult. A very difficult moment when we built the factory in Israel and going by the regulation, and when the regulatory authorization changed something in our building and we needed to change the way of thinking in order to get the approval, the permit for the factory, was also a very difficult moment. FDA regulation is regulation. You need to deal with regulation. So you need to work very hard to answer all questions. They will ask you more questions. You need to answer again and again. But you know, you are dealing with the FDA. FDA is not a black box. So FDA, it's a challenge that you need to pass. All my life, I'm raising money. And I can tell you that this is one of the most complicated things to do, to raise money. Every deal is a tough deal. Nothing comes easy when you raise money. It's for the last minute. Nobody will come and give you the money in an easy way. So always you have difficulties. It's not fail. You need to be very creative when you raise money. God willing, when we raised money for Alphatau, from the beginning, we had a very fortunate that we finished the first round, and then the second, the third one, and it was a big challenge, and we did it in the last minute, just before the market closed. Timing is important when you raise money, and God willing, we had a very successful also when we raised money to Alphatau. Alphatau targeted 3 different pillars. The first pillar is for indication that have a lot of standard of care. The second group is the unmet need, like GBM, glioblastoma. And the vision of the company is the advanced metastatic patient, to use and to combine our product with checkpoint inhibitor. This is another medication in the field of cancer that reinforce the immune system in combination with the Alpha Dart to treat advanced metastatic patients. Those patients are very poor, have nothing to do, and we want to change the world. So I'm almost in the last 20 years in startup company, and startup is very unique. You are waking up in the morning and you are dealing with challenges that nobody deal with before you, and you need to make decision. You need to create process. You need to create something new. And this is very, very difficult. Because if you go to the FDA and you do something that everyone did it before or someone did it before, it's easy. You look on the file, you see, and you do it. Here, everything is new. Everything you do, when you do a breakthrough, so at the beginning, nobody understands you. Everybody thinks that you are coming from the sky. Everybody thinks that it's very dangerous. It's very risky. I cannot understand that. And you need to explain it again and again and educate the people. And you are waking up every morning and you are changing the way of thinking. You are changing the way of something that you are building. Everything is new for you, and this is what I love in startup.